This is the annual meeting of reproductive endocrinologists. We're in Baltimore this year. There are 500 physicians, endocrinologists, nurses learning and teaching, and we're standing here in the exhibition hall. There are probably 300 vendors that are selling, new equipment for the lab, media, marketing tools. It's just a great time. We had a debate yesterday on recurrent pregnancy loss and genetic testing. There's a little bit of a controversy because the guidelines from ASRM were printed in 2008, and those guidelines say that there's no reason to do any type of genetic testing when a patient has recurrent pregnancy loss. We published with Dr. Brzezina several years ago our recommendation that in couples that have balanced translocations, that means the genetic makeup in one of the parents is mixed up, and when they have a baby, the chance that that baby's going to have abnormal DNA composition and result in a miscarriage is very high. So we recommended that those individuals undergo in vitro with genetic testing and transfer the embryo. Interestingly, when we surveyed the physicians that were in the room, 84% agreed with that strategy. That's against the current guidelines of ASRM, but it follows the recommendations that Dr. Brzezina and I made several years ago. The second question was, if a couple has unexplained recurrent pregnancy loss, nobody knows what's going on, should we just go ahead and do IVF and do genetic screening for trisomies and other problems? Now, we've not recommended that. Despite that, over 2/3 of the physicians in the audience are already doing that. So we debated that back and forth. What we learned here this year at ASRM, all our staff, our administrators, our nurse, our laboratory embryologists, and the physicians, all were taking different courses here. And when we get back to Memphis, we're going to have a conference, and each one is going to give a little mini report on what they learned in their session. So we've got 8 different full-day classes that we participate in. One of the ones I participated in was fertility preservation, and in the Mid-South, we're one of the first centers that actually has done fertility preservation for eggs and sperm. What we learned is a lot of people are freezing eggs or oocytes. Very few people have actually thawed them and have live births. Out of our first 5 lots of eggs that we froze for fertility preservation and have subsequently warmed up, 4 of those 5 have resulted in pregnancies or ongoing pregnancies. So very good success rate. We also help the children at St. Jude who are being treated with chemotherapy and radiation therapy. I had a call yesterday. We started a cycle of oocyte preservation in an 18-year-old with Hodgkin's lymphoma, and we're going to be able to preserve her eggs and freeze them so that she's going to be able to have a chance to have children in the future. So we learned how other people are doing this, how they've set up clinics, what are some of the strategies that they're using to shorten the time interval, and all these thoughts we're going to bring back to Memphis and be able to help and serve our patients.